Hello ladies, welcome back to my channel. My name's Heidi and I've created my YouTube to document all things perimenopause, midlife, and I'm also a mature student. So at midlife I decided to go back to university and study psychology counselling. One of the subjects that I wanted to talk about was blood tests. So when women go to the doctor because they feel like they might be in perimenopause, or just generally when you're feeling unwell and you can't put your finger on what's going on, the doctor will always say, do you want us to run some bloods, with particular things in mind. So when I felt like I was likely in perimenopause, or I was experiencing some symptoms, in fact it was before that, before I even put my finger on, I could be in perimenopause. These symptoms are what happens when my body is lacking in estrogen or progesterone or testosterone, or all of them. So my story in terms of blood tests, because I know some people hate blood tests, or they just will avoid having them because they don't like needles or they don't like doing it. One thing I would say is it's kind of important that you do have them. Although a lot of doctors will say, if you listen to the podcasts around menopause, perimenopause, the doctors will tell us, you can have your hormones tested and it may show up that you're low in something or high in something. But during perimenopause, your hormones fluctuate. So it might be that they do a blood test one day and the results come back as fine, or what they would measure as okay. There's nothing to worry about. Whereas if they'd done it later that day or even the next day, your levels could show completely different for all of those different types of hormones. However, when I went to the doctors because I was feeling unwell, the main things I kept going back for were migraines. I just kept getting migraines. I felt like I had a migraine all the time, and I'd never suffered from cluster migraines before. I have always been that migraine person where I would get them, but not really regularly until around 41, when I had problems with my periods. I then started getting migraines and I felt like I had a headache all the time. I would wake up in the morning with a headache. And so I went to the doctors for bloods, because I ruminated the fact that, it's because you're addicted to coffee. You have to have a coffee when you get up in the morning. Put it down to, you don't drink a lot of water, you should really drink a lot of water, all those things that you do. So I went to the doctors and I had blood tests done. Now my results come back as lacking significantly in vitamin D, which is common in everybody, in all humans, adults generally, especially in Europe, we lack in vitamin D. I also had my pituitary levels were high, which is my pituitary gland, I think that's how you say it. The levels of that were high, and of course I googled that and it come back with things like some people have a growth on it, and your pituitary gland is like at the front of your brain. If I can find a picture I'll put it on just so you can see. But anyway, I went into full panic mode about this. I thought, oh my god, I've probably got a growth. What if they need to remove it? It's kind of like brain surgery. They actually do like a keyhole surgery. Anyway, I went back to the doctors and he was your classic, I've been a doctor for lots of years. He was quite a hype doctor, and he come into the room because I was with a student doctor and I'd said what my concerns were, and I'd done a little bit of research, and could this be why I'm getting really bad headaches? So he come in and he was like, your levels are high but they're not scarily high, and it could be when we test you again they're fine. It's really not anything that I believe you should be concerned about. However, what exactly is it that you would like us to do for you? Kind of gaslighty, I would say. And I thought, I want you to do a brain scan, because I was really worried. So anyway, I had a scan, a CT, did I have a CT scan or an MRI? I ended up having both between the ages of 41 and now. I'm 47. I've had both, but just on one part, because I also had tinnitus so bad, and I'd never had that before either. Now, again, that is a perimenopause symptoms. But I guess this video today was more so about if you go to the doctors for blood tests and you get different things come back in your results, in my experience, I would try and link those together, especially if you think you're in perimenopause, because my vitamin D was low. That's common in perimenopause. Anything that reacts with your hormones is affected when you're lacking in, estrogen is the main hormone that we talk about all the time, because we have estrogen receptors in every single part of our body and our brain. It interacts with everything. So when something comes back in your bloods as not quite right, see if it could be a possible link, because now when I look back on reflection, that's probably why my pituitary results come back different. That's why I was experiencing migraines. That's why my periods were heavy and I was given the Mirena coil. I also had high cholesterol. And obviously the doctors give you this little leaflet about the foods that you should eat. You should have a Mediterranean diet. And no one tells you that your cholesterol levels can be affected, especially if you are a black woman. Cholesterol levels are known to be high. And that was another thing I didn't know until I started doing my own research. Now, when I went on to HRT, everything changed. So my vitamin D, I was prescribed by the doctor like a higher dose to take for 2 weeks and then continue just taking the over-the-counter vitamin D. But when I started HRT, my cholesterol levels come straight down. My bloods come back as fine. It kind of evened out. So I guess in a long-winded way, I just wanted to say that when you go for blood tests and you get things come back, ask the doctor what they mean, and then maybe do a bit of your own research around whether it can be linked to the menopause. Ask the doctor, could this be to do with perimenopause? Is it to do, because they quite often say, don't they, a woman of your age will experience, a bit of body pain, and a woman of your age will get tired because you're juggling lots of different things. And it's true. But no one actually says anything about the fact that it could be your hormones, or because you're lacking in estrogen, it's affecting all the rest of your body. So if you're lacking in vitamin D, it impacts your immune system, helps support your bone health because it helps your body absorb calcium, helps control infection. This video, I hope it kind of makes sense, because I didn't want to avoid it, because a lot of people mention having blood tests, or they say, I've had friends that I've spoke to and said, your symptoms sound very similar to what I used to have pre-HRT, definitely go to the doctor. And they'll say, I had blood tests and the doctor said that they've come back clear, they're fine, they're okay. And you can't just go on blood tests alone. But if things do come back, do your own research to see if they link with the fact that your estrogen levels could be low and it's affecting all these other things in your body and the way that your body functions. If you like that video, please like and subscribe. My next video is actually going to be on my experience so far of perimenopause, the symptoms I've experienced and how I felt and all of those things. So please come back to watch that. Thank you for listening. I hope it wasn't too chaotic and blabbery. Yes, come back. I'll speak to you soon. Bye guys.